Today we're working on active knee rotation, focusing on that tibial rotation, which means the rotation of the lower leg relative to the femur. This is a crucial part of the knee that often gets overlooked in regards to the knee function. So this is something that's going to help support better gait or walking, your squat mechanics, and injury prevention. Active knee rotation drills like this one help improve joint awareness and the rotational capacity and resilience at the knee. It's especially valuable for an athlete or a lifter or anyone working through some sort of knee rehab or really trying to focus on building long-term joint health in regards to preventing some sort of knee replacement. So let's go over the setup. We want to sit on the floor or a bench with your hip and knee bent at about 90 degrees. We're going to let your foot rest slightly on the ground and your heel is planted or not bearing any weight. You can sit tall with your hands at your spine or resting on your thigh, or you can be holding onto your leg like so. I'm going to start by gently externally rotating the tibia, which is the lower leg rotating outward. I'm going to move nice and slow, and I'm not going to try to compensate through the foot. This motion happens at the knee, not at the hip or the ankle. So I'm trying to keep this all nice and still. Then we're going to slowly move through internal rotation, and that's by turning that foot a little more inward now. And again, from the knee joint, not through the foot where it's doing weird things like inverting. Sometimes it'll feel like it tightens up the inside part of your hamstring, which is a great thing to be doing. And then you'll go back through external rotation and feel the outside hamstring. The movement should be subtle and controlled. You're rotating the shin bone and you're not shifting your whole leg or your hip. You want to keep your thigh stable. So if it's moving and compensating from the hip where you're moving side to side or in like so, then we're trying a little too hard and we're not quite stabilizing and utilizing just the tibia through its motion that we can have. So don't rush this one. It's all about control. We want to hold those end ranges for about 3 to 5 seconds. We're going to be doing this for time. So it's going to be about 60 to 90 seconds worth of slow, controlled internal and external rotation of that tibia with a mild pause at the end range.